Hello, everyone. Welcome to our webinar, COVID-19 and School Response. My name is Sarah Porter, and I'm the Vice President of External Affairs at Healthy Schools Campaign. Today, I'm representing the Healthy Green Schools and Colleges program, a partnership between Healthy Schools Campaign and Green Seal. Formerly called Green Clean Schools, this program leverages more than a decade of Healthy Schools Campaign's work, along with Green Seal's additional expertise, providing even more resources for creating healthy, sustainable, and effective cleaning programs. Before we begin, I'm going to quickly review some basics for today's webinar. Today's webinar will run for approximately 1 hour, and a recording of the webinar will be available to view later. We will email a link to the recording, and it will also be archived on the Healthy Green Schools and Colleges website. We're going to save the bulk of our time today for a question and answer session with our committee members. You can ask questions by typing a question into the questions box located on your control panel and clicking on the send button. Feel free to send questions through the questions box at any time during the presentations, and we will answer them during the Q&A session at the end. As you all know, earlier this year, schools and universities closed their buildings and quickly transitioned to online learning in response to COVID-19. Many schools are planning to welcome students back in some capacity this fall, and custodial teams are working around the clock to develop and implement policies and protocols to protect the health and safety of students and staff. The Healthy Green Schools and Colleges committee members are here today to share their experiences dealing with COVID-19 at their schools. Last week, we hosted 2 webinars, one focused specifically on the reopening of K-12 districts and the other on colleges and universities. In case you missed them, both of those webinars are available to watch on the Healthy Green Schools and Colleges website. During today's webinar, our speakers will focus on themes that emerged from the questions posed by the attendees of those first 2 webinars. From proper disinfecting protocol to quality assurance, concerns about transportation, and staffing challenges, we have lots to cover today. Please note, the information shared during this webinar is for general informational purposes only. The experiences and information shared today are not intended to replace, directly supplement, or formally operationalize the guidance provided by the U.S. federal government, including recommendations published by the Centers for Disease Control, the Occupational Safety and Health Administration, and the U.S. Environmental Protection Agency. We encourage you to visit those federal agency web pages if you are seeking formal instruction on how to develop or update your cleaning protocols in response to COVID-19 or any public health emergency. We will include links to these resources in our follow-up email. Today's webinar is a knowledge sharing event in which the leaders of green cleaning and building operations in higher education and K-12 districts will share their experiences. On the webinar today, we have Mervyn Brewer, Assistant Custodial Supervisor, Salt Lake City School District in Salt Lake City, Utah, Christopher K. Rains, Director of Administrative Services at Cosumnes River Community College in Sacramento, California, and Kimberly Thomas, Director of Facilities Management at the University of Georgia in Athens, Georgia. First, I'd like to introduce Merv Brewer from Salt Lake City School District in Salt Lake City, Utah. Merv?
Whoa, thank you, Sarah. My computer just crashed, literally. I mean, it fell. Hope y'all can hear me okay.
We can hear you. We can definitely hear you, Merv. Go ahead.
Okay, so here we go. We are a school district of about 26,000 students, have approximately 40 facilities, and I say approximately because you never know what we're going to add at any given time. But our plan for opening is that we will be sanitizing high traffic areas, touch points, critical areas multiple times a day. And then in the evening, we will be going through using the CDC guidelines, doing a deeper sanitization where you first clean the area and then using an Enlist product, we would be going through and disinfecting, if you will, those areas. So that's our plan. We talked about it a week ago, but I wanted to get a little bit deeper on a couple of things. First of all, let's talk about something called integrated pest management. It is a common sense approach to pest control. The words common sense, I want to take that out of IPM and I want to place it here. Common sense. Let's use some common sense with talking about how we're going to go about taking care of these things, shall we? First of all, some folks were asking about carpets. What are we going to do about carpet? I mean, what can you do about carpet? You can't disinfect a carpet, correct? Well, according to the verbiage, according to national guidelines, no, you can't, because it's not a hard surface. But you know what? Let's use the common sense word here. So if I'm going to use a Enlist product, and what we use is hypochlorous acid. We on-site generate, we use those little tablets that are on the Enlist. There's a hydrogen peroxide product we use. So let's put that into our carpet. So you've got a carpet, you want to take care of the carpet. That's what we would use to, quote, sanitize our carpet, because we can't disinfect it, but we would use those types of products in an extractor, sprayed into the carpet, suck it back up, and that way we would sanitize it as much as we possibly can. Now, keep in mind the word sanitize. Sanitize is a reduction, and disinfect is also a reduction. It's a higher reduction. It kills more, but I don't know that I've ever seen anything that says disinfecting kills 100% of everything. So keep in mind, we are always talking about some kind of reduction. So in using common sense, let's look at what we would be doing on a daily basis. Daily basis, we are going through and we are reducing by using a sanitizer. Now, you guys have seen this at the grocery store, I'm sure, and other places you go. The little sales clerk will come up behind you, they'll spray an area and they'll wipe it down. That's not disinfecting. I don't care what product they're using, spray and wipe is not disinfecting. Okay, that's removal, and removal is very, very important. And that's sanitizing, and sanitizing is very, very important. So we plan on doing the same type of thing. Those high touch areas during the day, we're not going to sit there and let something soak for 5 or 10 or 15 minutes between class changes or what have you. No, we will go through on a high frequency rate and continually spray and wipe, sanitize these areas. So we are going to reduce numbers all day long, so that when we get to the evening part of our sanitizing, by CDC guidelines, we will use a cleaner to clean the areas first, and then use an electrostatic sprayer with an Enlist product, which will be our hypochlorous, and we will mist that into the area and, quote, disinfect. I still don't like that term disinfect, but we will do a higher level of sanitizing of that area. Okay. Our biggest challenge in all of this, of course, is staffing, because one of the huge problems that we're all going to have is your people are going to get sick. They can't be at work. They're going to get sick from other things too, not just COVID-19. Mind you, we will get into flu season and a whole lot of other reasons that, well, you just don't have the FTEs, you don't have the people there to take care of these things. So we've got to sanitize more often, and now we don't have as many people. So that's going to be the biggest challenge, because from day to day, you never know who's going to come down sick. Okay. That means that other cleaning for appearance things are going to be done with less frequency. Okay, some of the vacuuming, the burnishing of floors, a lot of the things that we used to do for a much more appearance sake are going to have to go by the wayside just a little bit, and the emphasis will be on this sanitization of things. Real quick, lunchrooms. Well, our school district has made the decision, unfortunately, to not use the lunchroom and other areas that are available and spread students out all over the building. No, they've decided they're going to have students eat in the classrooms. That is a huge problem, isn't it? So we are going to have to still do our vacuuming because we have a great integrated pest management program. We don't want to get pests. We are also going to have to make sure that after lunch, things are sanitized properly. Buses, there's another problem as well, in that you've got a group of students, they get off the bus, that bus driver is going to have to be equipped with some kind of a sanitizer for a spray and wipe, or some kind of a electrostatic device to mist the bus between pickup and delivery of students. So those are just a couple of little things I wanted to touch on real quick. I'm going to turn it over to my colleagues and let them cover some of the other items. Thank you.
Thanks, Merv. Yeah, I think you definitely hit on so many of the things that we're hearing about with our K-12 folks, especially between school food, transportation in particular. So thank you for covering those. I'm sure we'll have more questions about them. Next, I'd like to introduce Chris Rains from Casunas River Community College in Sacramento, California. Chris?
Good day, everyone. Pleasure to be here. Looking forward to talking about these things. Los Rios Community College District, which I'm a part of, they shut down all their sites and went remote right along with everybody else. We're currently working up on a draft plan for reopening, which is it's a step plan of a 45-day, 30-day, 15-day steps of what'll take place. The start of it is the maintenance HVAC guys and electricians come back into the buildings that we have scheduled to be reopened in the fall to make sure those buildings mechanical systems are working correctly and are up to snuff. At a 30-day mark, the custodial staff will be brought in to start cleaning and disinfecting of those areas to make sure they're ready to go for the lab classes that will be happening. And then at the 15-day mark, we'll be coordinating and sort of mapping out the flow of the buildings. You know, if you have a room that has, for nursing, that has 2 doors into the room, which is the entrance, which is the exit, how are we checking people into the classrooms, protocols for cleaning schedules and various topics that will come up, signage, putting up any additional new signage, either be it on the ground or on walls for visual references for people, sneeze guards at any locations that may have direct closer interaction inside that 6 feet window to where you actually have to be closer to communicate with somebody, getting all those in place. One of the things that I've been on guard with in all of these changes has been scalability. Right now, I have a staff of about 25 custodians that have not really been utilized at all during this shutdown. I got a rotation of 1 custodian a week coming in to do various things a couple times a week. So I have a lot of pent up energy of a custodial staff, but we can't build a program that when we go back to full on-ground instruction in the future, that whatever we put in place now, we won't be able to maintain later on. So as an example, working out with the auto shop teacher, his lab lecture period, 20 kids, the lecture is online, but 10 kids will come in on a Tuesday, spend 5 hours in the auto shop, and then leave. And then we'll come in and clean and disinfect what we got to do. On Thursday, the other 10 will come in, spend their 5 hours, leave, and go in. So the custodians are still basically doing it the way we had been doing it before, coming in at the end of classes, cleaning the building really well once a day instead of multiple times a day. We will probably increase our custodial staff during the day to do the touch points like Merv had talked about, and having for lack of a better term, a hyper focus on those things to where they're getting done far more frequently than they ever have in the past, just to get everybody sort of used to that you can come back, have your masks, do what you need to do, but the building is healthy and clean. and I can't stress enough, as going along with Merv, is the resetting of the thinking of cleaning for health, not appearance. I would rather have doorknobs and restroom fixtures disinfected hourly than floor being dust mopped and spot mopped, or it being shiny and pretty with fresh coats of wax, or fingerprints off of windows and things along those lines. I would rather have cobwebs than people getting sick in the building. The custodial staff and the changes that I think that we'll be going through should be not different than what they're already doing, but the frequency and how they're doing things will change up. So the same steps will still be there, but the frequency of some of them may be lessened and others will be increased. But at the same time, coordinating out and articulating out to the various constituency groups on what part they have in maintaining and helping the custodial staff do what that they can do, i.e., washing your hands more frequently, using the wipes to sanitize and not disinfect, because I agree with what Merv was saying. You can sanitize surfaces, but the wipes aren't necessarily disinfecting them unless you really are following the directions that are written on the bottle. So all these plans are in very much a flux with the recent outbreak of the COVID in California. We could be doing a lot of work to be shut right back down and not have anything happen. My motto has been on that one is we have to function like we are going to reopen, and if we don't, we don't, but we have to have a plan in place to open when we have it there. So stepped system and sort of doing it as methodical as possible, because when everyone does want to come back, everyone's issue is going to be the most pressing issue of the day for them. And why we're trying to, as a custodial department, take care of everybody needs, you really do have to have that stepped methodical approach in what is going to be dealt with this week, and put off the last minute honeydew things that a department has come up with that they think they just need to have right here, right now. So with that, I will turn it over to my colleagues.
Thanks, Chris. I think you're really focused on something that so many folks are grappling with, how to start with a plan and continue to evaluate and scale that plan as more and more folks return in person. I know that we're not at the Q&A yet, but if I could just ask you, I want to ask you to talk a little bit about one specific thing you said. You were talking about cleaning for health, not appearance. Do you envision any sort of what's your messaging plan? Do you envision sort of any comments or pushback when folks sort of look around and visibly maybe things don't look as clean because it's not for appearance, but again, of course, your focus is cleaning for health. Like, what does the messaging look like for your students in larger school community on that piece?
I think some of that is the signage portion on putting up in the classrooms, or what articulating out what we're talking about by this is what we're cleaning daily. This is what we're now going to do weekly. It's a little different than like a K through 12 a counterpart like Merv, in not vacuuming a third grade classroom. Probably still needs to be done, but dealing with college kids and that, you might be able to limit the amount of time you're vacuuming, or break your team apart to where someone is just, that's what they're going to come in on graveyard and all they're going to do is vacuum, because they're no longer doing a restroom or dust mopping or cleaning whiteboards. They're just going to vacuum and sort of go around each building one day a week and take care of that one building. So it really is a messaging thing. I'm working on putting a little YouTube thing out to sort of show what we're doing with the staff. So as everyone's coming back, they sort of have that visual little reference on how the custodians are deep cleaning the rooms and what we'll be cleaning daily versus weekly.
Great, thank you, Chris. Finally, I would like to introduce Kimberly Thomas from the University of Georgia in Athens, Georgia. Kim?
Thank you, Sarah. I had to make sure I unmuted myself here. It's been great information coming so far from my counterparts in this webinar. I want to thank you for joining us. At the University of Georgia, we're about 60 miles east of Atlanta, and we're the flagship four-year research institution for the state. And even though we have been closed to students since around March or April, we have had our campus to be impacted by about 143 confirmed COVID cases, and including, unfortunately, some of our staff. So Merv really touched on the standpoint that we do have our frontline people who are, working hard to keep our campus safe, but it puts them at exposure. And so just to give you a little bit about how we have planned our phased reopening, we have 3 phases, the first of which started back in early June, and we are now entering our phase 2, where we have most of the campus faculty and staff coming back. And so with that, we've had a lot of preparation in trying to get our buildings up to snuff, doing a lot of building walkthroughs, making sure that we're running water, checking our energy standpoints as far as HVAC and things like that. A lot of this information on reopening can be found on the attached documents that Sarah will post on the Healthy Green Schools and Colleges website. It's a 229-page document. So if you need leisure reading, it's there. A little bit more about what we have been doing. Our supervisors have had mandatory online and in-person training on how to deal with our COVID procedures. Once we have been contacted that we've had a positive or even a highly suspected COVID exposure in our rooms. And so they have been trained on how to proceed with that, how to mark those areas, isolate those areas from other staff who might be working in conjunction with that. And we have a process where those are reported into our work request center, so we can keep a track and we can communicate back and we can keep a log. So I definitely would encourage all of you all to have some type of reporting structure so you can go back and ensure that things were cleaned and disinfected properly after your cleaning staff has went in and did their cleaning. And that just helps them understand what's happened. If there's any questions from your customers, you have a way that it's been documented as far as what has happened. A little bit more as far as with our phase 2, we are installing disinfecting wipe stations because of the marketplace limitations on hand sanitizers and things of that. We have tried to encourage through our communications plans that went out through the campus, as well as other marketing materials, that we want people washing their hands with soap and water. However, we do know that there's going to be some places where they do not have access to that. So we have an active plan to install several disinfecting wipe stations so that our campus can help assist our custodial staff. We don't have enough staff. I'm sure most of you don't have enough staff to clean and disinfect all of the areas around your campuses or in your schools. So we have had a lot of support from our senior administration to put that out as part of our return to full operations guidance, that we need this support and their active participation to help disinfect their personal spaces, like their individual offices, where we have put out the word that our cleaning staff is really going to focus on public health and safety and not just appearance, as Chris just touched on, so that we're going to need them to remove their own personal trash and recycling to hallway containers, in addition to use these disinfecting wipe stations so that they can help our staff, help them to stay clean. As far as classrooms, that's a key thing for us. We have been told that we're only going to get an additional 5 minutes when we open back up to the fall as part of our phase 3, which starts in August. So that's not enough time to clean 650 larger classes around our campus. And so with that, that's another reason why we had to solicit the active participation from our campus staff to help support disinfecting inside of their personal spaces. We do have social distance kits that our faculty and staff are using right now as part of phase 2 to mark off seats inside of classrooms so that they can put signs, don't sit here, you may sit here. We've spaced out across the various rows in the auditorium style lecture halls. And they're also going to be a part of the class will be using remote learning in addition to staggering who can return to class. Another thing we've talked about is we have had a classroom cleaning time study conducted by a third party OSHA and ISSAI certified training team so that our staff has a really good idea of how long it really will take us to clean and disinfect each and every one of our classroom spaces, whether it's a larger space or just a small general classroom areas. And again, that goes back to quality assurance, where in the past we have used ATP readings to just make sure that what we are cleaning are hitting the targets that we want. And also I would encourage you to have a checklist so that the staff can really hone in on those high touch point areas that you want them to focus in on. Another thing that we're doing, we're actually using part of our grounds and landscaping crew to assist us with disinfection of our exterior handrails outside of our buildings so that we can try to provide as best possibility of keeping these surfaces as far as contact exposure to a minimum as much as we possibly can. So disinfecting outside, leading into the building, using our custodial staff to do the high touch point areas inside are all kind of the things that we're focused on in UGA. With that, Sarah, I'll turn it back over to you and see if there's any additional questions that I can assist with once you open it back up.
Thank you, Kim. You covered so much. Really appreciate everything that you shared. And I know that you mentioned this already, but we do have a resource hub on our website. We'll be including a link to it in the follow-up email with many of those resources, Kim, that you've already shared with us are there. So thank you. And thank you again, Kim, Merv, and Chris. For everything that you've shared so far. We're going to now open it up for our Q&A session. So once again, go ahead and type your questions into the questions box on your GoToWebinar control panel. Hit the send button. We're going to get to as many questions as we can. And in order to help us do that, I'm going to introduce Mark Bishop, one of our other committee members, who's going to be directing the questions during this session. Mark?
Great, thank you so much. Let's just jump in because questions are already rolling in. I'm going to start with a question from Merv. Merv, Chris, Kimberly, why don't you all just leave your microphones on so you can jump in. So Merv, you talked a lot about high touch point areas for disinfection. What do you consider the high touch point areas that you are focusing on?
So in our K-12 buildings, it would be places like, start with the outside doors, the door handles on the outside doors, the crash bars on the inside, those parts of the windows that everybody continually touches, and doors going into the building. In the main office, your countertops, your doors, places like that. When you get to the classrooms, you get the classroom doors. When I say doors, I mean the window glass too, because kids touch all that kind of stuff. The restrooms, you've got the walls, the doors, going into the restroom where of course kids put their little hands out and touch all that stuff. We're all familiar with those areas. Sinks, partition doors, all of the places in the restrooms, that would be a high traffic, high touch point area. So as you go through your building, and maybe it's a good idea to do an assessment, walk through your building and think of all the places that when it's full of people, they touch constantly. And those need to be your high touch point areas. Elevator call buttons, things like that.
Mm-hmm. Okay, great. Thank you. Let's keep going. Chris, I think you generally answered this question, but this is a little bit different. You mentioned cobwebs and fingerprints as things that may not be focused on. And you talked about your communication around getting people understanding of the changes. But how is your administration on board with the potential for seeing a building that's not as visually clean? And was that a challenge getting them on board? Did you have to get them on board, or were they understanding from the beginning?
I think that the jury's still out on that, being that we're all still remote. I would like to say they're on board in theory until they see something that is visually unpleasing. Then it might become a topic. So it's an education topic of conversation and teaching moment just as much for them as it is as the custodial staff.
Mhm.
Again, giving any visual indications that you can have on what you're talking about when you say touch points and what we're doing daily, to give them, again, counterpart of mine, he's also on the steering committee, Tony Alameda. He has a good little slide that it shows all the touch points that are in red of what we're talking about. That's a visual for the teaching staff and then a parent or anyone along those lines. The tougher thing, if I've always felt with frontline custodians, is even though you tell them, hey, don't do this, they just have to do it because that's the way their areas always look. So it's I have more concern about custodial staff overdoing than complaint out of the administration due to cobwebs or something looking along those lines. Because again, I would rather have cobwebs than COVID. Has always been my thinking.
Okay, sounds like a new tagline for you.
Thank you.
Let me, hey, Kim, a question about UV lighting. Now, there's a question asked about the use and our thoughts of UV lighting. It's not clear whether it was for surface disinfection, for classroom disinfection, or for HVAC disinfection. But Kim, do you have any experience of looking into UV lighting and the use in the educational setting?
Yeah, we have looked at UV lighting in a couple of settings. At UGA, we're looking at that to see how it can affect and improve our HVAC systems. And the jury is still out. I know there's been some question on the effectiveness of it. We just personally have not seen enough data to show us that we want to make a large change to that as of yet. And when I also worked in a K through 12 school district, we looked at that in some smaller applications, like in portable facilities, not the main brick and mortar schools, but we did have to have some portable trailers for overflow. And in those smaller units, they did appear to work. But as far as at the University of Georgia, we have not seen enough data to show us that we want to go down that road just yet.
Mm-hmm. Okay, thank you. Merv, question for you. Floors. This one just came in. Floors are often the most soiled area of any facility. Have you guys considered a disinfection of floors practice? Has that been in your repertoire at all?
Nope. Other than in a restroom, But there again, I'm not sure of anybody who eats off floors, although I do have some floors you probably could eat off of. But for us, that has not been a huge concern because the second somebody walks across that floor, they track in whatever. So for us, no, it's a matter of keeping them clean.
Mm-hmm.
Floors we want to keep as dust-free as possible because, again, anything that could attach itself to dust and settle on the floor and that be redistributed as people are walking around or the wind blows, whatever, we want to try and keep them as dust-free as possible. But other than that, no, we see no reason to disinfect corridor floors. Keep in mind that in a classroom, you've got carpeted floors quite often, and by definition, you can't disinfect those.
Mm-hmm. Then follow up on the carpet question. How often are you cleaning or sanitizing carpets?
That is a great question. So as far as the vacuuming of carpets, that has been a daily routine for us. However, that's going to have to go. It's not that it's not a priority, but like Chris just said, I'd rather rather not have COVID. I'd rather have clean, sanitized areas than COVID. So touch points like desks, those areas that are higher touch points, higher, how can I put it, a higher hazard would be a bigger priority for what limited staff I will have available to take care of things. As far as the frequency now, we are hoping to go to a twice a week on the vacuuming. But when it comes to carpet cleaning with water and an extraction unit, honestly, that's still going to be an annual thing.
You spoke about sanitizing with your list end product of your carpets. How often are you doing that?
Well, using an electrostatic sprayer on a daily basis, you can't help but get that on your carpets. Or if you're using a fogger, whatever technology you want to call that, that's going to get on your carpet. So what's that going to do? Well, that's going to, quote, sanitize on a daily basis.
Okay. All right.
And Mark, if I could add in a little bit from our perspective at UGA, we have posted in our guidance where some of the high areas as far as our cleaning frequencies, and even from the understanding of classroom and teaching labs, clean and disinfect, we list out the touch point areas on a daily basis, auditoriums, we list out that as daily basis, the libraries, any learning centers, like student lounges and things like that in our study buildings, all of that is daily basis, restrooms, health areas, rec sport areas, all daily basis. And then when we get down to the offices, we specifically say infrequent basis. And we talk in there about just a limited general cleaning due to our staff having to reshift their focus to cleaning and disinfecting for the public health of our campus community. And then we also talk about the things that we are providing for individual office holders to help maintain their personal space.
Great, thank you, Kim. Let me keep going through a few more, keep going around. Chris, can you speak a little bit to your budget? Has it gone up or down? How will it impact your operations in this time period? Are you advocating for more money? And if so, are they attentive to your requests?
I have advocated for more money for the specialty equipment, the electrostatic sprayers, additional PPE. Part of that has all been, I've been instructed to basically order what I need to order, and when I run out, there'll be budget augmentations as needed. But as an example, for this fall's career technical education labs that are going to be on site, again, that's welding, construction, automotive, nursing, each department is responsible for ordering their PPE. So it sort of keeps it in, because for the simple reason, some of those departments are categorical, so their budgets may not have been impacted as a general fund has been. So there's that, and then tracking what we've had to bring online to go back to the federal government and ask for through FEMA, ask for the money back down on the backside, which will, again, sometime in 2025 that'll probably take place. But that's currently what we're doing. Budget impact has been more on the staffing side of it, where we've all had our temp classifieds told we're not hiring and will not be rehiring any temp classifieds. So Merv alerted to it earlier. this fall, as I start having people back on site, but then they get sick, I won't have anybody to backfill that custodial string because 2 or 3 people have gone out sick. That's where it'll start to get a little interesting on how we maintain a higher cleaning level and sanitation level with less people and no money to bring people online.
Mhm. Okay, thank you. Kim, I've got, here's a question I think is a really interesting question. We know that the prevalence of person-to-person transmission is probably more significant than surface transmission of COVID. So how is your school, how is your department handling balancing the needs for social distancing in terms of COVID, controlling spread of COVID, and the needs of cleaning and disinfection? How do you balance those two needs?
That's a great question. And the realist in me says that we're going to have to kind of see if what we're planning on as far as our action plan is going to be as effective as it needs to be. Here at UGA, we have a little small thing called football. And with that has tailgate weekends, almost every weekend. So a lot of that person-to-person versus trying to maintain surface cleaning is going to be a delicate balance. And the plan has to be through the week, the regular school week, we have to focus on our high touch point areas and our surface cleaning, assisting our faculty and staff with marking areas to social distance inside of the buildings, whether it's the classrooms, it's in the hallways, or it's in the study lounges or the library. So working with them to assist as much as we can, but then turn our attention to, now, what can we do on the Fridays of football weekends, and how we can try to help maintain some of the surface areas, as I mentioned before, with handrails, other places where people might touch around the gated areas going in and out of commonly used areas that have metal surfaces, whether it's kind of like a fencing or things like that where people would be congregating. And so we're just going to have to try to maintain our frequency level and be very watchful. And again, as I mentioned earlier, taking logs of where we have high exposure areas and making sure that we're doing as best job as we can. Great.
Thank you, Kim. I have a question that I actually want to throw out to all of you. So one of the themes that you guys all repeated was the issue of public health versus appearance. So I would just love to get all of your perspectives. Think of the one major thing that you find that you're doing significantly less of in terms of appearance that would have shocked yourself of 4 months ago, and the one thing that you're doing, the one significant thing you're doing now that you weren't doing or weren't doing much of at least 4 months ago. If you would all take a moment to think about that. Merv, would you be willing to give that a try first?
So I would say significantly less burnishing of floors. We had, I would put our floors up against anybody's in the nation, and I know that's arrogant, but guess what? Our floors were that good at one time. We would high-speed burnish them with a propane burnisher on a nightly basis in most cases. You know what? Burnishing has gone by the wayside a bit. We are doing other things to have a shiny floor as possible. However, our priority has shifted, of course, to the sanitizing of our buildings. So what are we doing more frequently now than we've ever done before? We are getting areas in classrooms such as desks, and those used to always be taken care of by teachers and their students, but we as custodians are doing them much more frequently now than we ever have before.
Mm-hmm. Great. Chris, what's the one big thing you're doing less of, big thing you're doing more of?
Well, we're still 99% off campus. I'm one of the rare birds that it comes into campus 4 days a week. We went from a campus of 14,000 students to me and 3 police officers and a couple people in print services. But the one major thing that I have upticked in my end of the world is as people do request to come on campus, the logging and location tracking for any trace purposes down the road if something goes sideways. But I would imagine going on what Merv said, it's the condition and the condition of floors, particularly VCT or a Forbo or a vinyl of that getting done on a regular basis. I just don't see it happening with the amount of touch points that we have to do. And going back real quick, briefly to doors, one of the places that I always tell everyone to disinfect is after you open the door. You know, you got someone like tall like Merv. Where does he put his hand to hold that door open for people to come through? So you can go about 2 feet up from that crash bar and people hold that door right there while everyone's holding it open. And that is actually one of the more nastier places on a door than the actual doorknob itself. So it's things like that.
Okay, thanks, Chris. And Kim, one more frequent, one less frequent. What do you got?
Less frequent, I would agree with Merv as far as stripping and waxing the floors. More frequent, just to change it up a little bit, is training. We have spent more time working with our other units around the campus outside of just our building services department to help them understand what cleaning and disinfecting can mean for their operations, like our bus staff, like our hotel and conferencing staff, like our 4-H staff that work all around the state of Georgia. And also ensuring that we can procure the cleaning and disinfecting materials and supplies that they need for 3 to 4 months stock in our warehouse to maintain what we need to serve our campus.
Great, thank you. All right, back to a couple of very specific questions. Merv, you mentioned the use of hydrogen peroxide and hypochlorous acid. In what situations would you use one versus the other?
Well, that is a good question. Most of what we are planning on doing as far as classroom sanitizing, it will be done with, okay, if the teachers, we're going to give the teachers the hypochlorous in a spray bottle with paper towels to wipe down whatever they want, whenever they want. But during the day, our custodians will be going around with the hypochlorous as well and a microfiber hitting all of these touch points. Where we will be using the hydrogen peroxide product and the one we use, we would be using that in the evening on things such as the restrooms where we don't have the Aqueous ozone caddies that we use. There's a few buildings we don't have that, so we would be using the hydrogen peroxide in those restrooms for the cleaning part, the deeper cleaning part, and then come back with hypochlorous in a electrostatic sprayer and spray the restroom down afterwards. Also, we would use if there was an event, we call them biological events. Somebody ralphs on the carpet, or somebody drags in some dog doo-doo from off the grass, then we would clean that using a hydrogen peroxide based product in our extractor, and then we would go back over with the hypochlorous in a spray.
Okay, thanks. Chris, I'm going to ask you this question. Have you had issues dealing with any of your unions or bargaining units in terms of asking staff to help you sanitize or wipe in the classroom?
Yes, and I won't characterize it as a problem. That there's been concern from the teaching instruction side of the house that they haven't had any training to use whatever chemical or disinfecting agent we would be providing them. I let them know that we can train a off the street custodian in 10 minutes of what to use and how to use it. And it's very simple, and someone with a degree on the wall should handle it just fine. I got a bit of a dirty look with that one, but it is part of that retraining, just not of someone who's wearing a blue shirt or as a custodian, everyone else, that you have an active part in maintaining your own space that you teach in or work in, on keeping it clean and healthy, just not for the people that come into it, but for yourself too. So it's really on those messages. I tried my very best to make it incentive based, not penalizing someone of, hey, if you don't do this, you can't teach the class here, or we're not doing this for you. It's more of, this is how you're helping us, and it's a really big thing, because we're taking care of cobwebs now, because we're not disinfecting the teaching stations that you use. So it really is. It's how you message it out to not make it a confrontational moment, and more of a come together moment.
Great, thanks. Hey, Kim, you have a bunch of buses. How are you managing your buses and keeping them safe and healthy? And then there's a specific question, fireproofing in a bus. Is there any concern of whatever chemicals you may be using of damaging fireproofing? Have you heard of that?
Yes, we have heard of that. Thank you for that question. I had a note and make sure I talk about buses more. So thank you for that. What we have worked with our campus transportation partners here, as I mentioned before, we're doing the training to help clean and disinfect. Their sanitizing schedules are twice a day. What they've also done is try to limit the number of drivers who will share that vehicle. They're trying to keep the one driver to that bus to try to reduce exposure.
Kim, what does sanitizing on the bus look like?
Sanitizing on the bus looks like an electrostatic sprayer with our botanical CDC certified product that we're using. And so that does not reduce the retardancy of the fireproofing that's already being used there. It's one of the things that we try to look for, a product that would not cause problems with the fireproofing on the seats in other soft touch areas inside of the bus, if that kind of helps.
Great, I think that was very useful. I've got another question that I want to ask all of you guys. When this pandemic is over, when we are out on the other side, how are you going to balance moving back towards that cleaning for appearance versus cleaning for health, which we all know is a you know, there's a balance that you make of how many cobwebs and fingerprints versus sanitizing you do. So what practices do you think are going to be retained and are going to be shifting your practices long-term versus what are you going to go back to the way you were doing before? Do you have any thoughts on that? And I'll throw Merv under the bus to start that question.
Sounds good. Actually, that's, I like that, because this is our new normal. This is where we are going. This is the direction we've wanted to go for some time, in making sure that the cleaning for health is a priority. This is just COVID, Okay, a year ago, how many people died due to regular influenza? So there's going to be something else come along. We have got to change the way we take care of our buildings with a higher emphasis on sanitizing. So for us, this is going to be the new normal. Now, we may not sanitize quite as frequently, but trust me, it will be the highest priority going forward in our school district.
Mm-hmm. Chris, what are your thoughts?
I think the interesting thing for me will be as the COVID's done and gone away, whether or not I maintain a custodial staff primarily on day shift and swing shift instead of what it was pre-COVID was 95% of my staff were at graveyard. They didn't interact with people. They maintained a building. So it's going to be interesting to see how that, as it goes back, because there's a financial component for the frontline custodians on that. You go to swing shift or day shift, you start losing differentials. So they want graveyard where budgetary wise and sanitary wise, it's better to keep them days swing. But again, you'll get a better clean appearance looking building by having them on grave, but a healthier building, in my opinion, having them on days or swing.
Very good. All right, so Kim, what do you think your post-pandemic changes will be?
I'm hopeful that it's going to look very much the same as where we are now. Number one, I think we've kind of touched on the funding issues that everybody is having right now. And so with that is, definitely a reduction in our staff. If our numbers cannot increase, then we're going to have to stay where we are, because this is the healthiest format for us, where we have our office staff working in conjunction with custodial staff to keep their spaces clean, to get their trash and recycling out, so that we can spend our time focused on cleaning for the larger good. And also, one thing I wanted to mention is that we do have a couple of sites that have contract cleaners on our outlying area or where we're leasing spaces, and we have them on board cleaning to our same standards, with our same products, with our same protocol. That part is not going to change either. So I think that's a positive, and it helps our customers all feel assured that no matter where they are, they're getting a good service.
Okay, so what I'm hearing from all of you is we're going to continue to see an even increased focus on health over appearance, and that's not going to change. It's 3 minutes to the hour, so I think I'm going to ask one more question and then hand it back to Sarah. So I hope I got to most of the questions that everyone was asking. So, but the last one is a specific one, time. I'm going to start with Merv. What do you, from your experience, what's the best time for cleaning and sanitizing during the school day? Is it between classes? Is it, I mean, how do you time your sanitizing, I guess is the question.
Well, I really would say that sanitizing is what happens during the day. Okay, you can do a certain amount of cleaning because you are, quote, spraying and wiping. So yes, you are cleaning as well. So that's good. But as far as a deep cleaning, well, you can do a lot of things during the day. And anybody who wants to know what you can do during the day, talk to Gene Woodard up at the University of Washington, where they do a lot of their stuff during the day, and they do an amazing job in keeping their buildings cleaned and sanitized during the day.
Kim or Chris, would you like to add anything about timing of how your operations work?
For me, I feel it's best to do it during the day and swing, where it's seen that you're doing it. So there's less mystery on if the building's being maintained or not. I have dealt with that before the shutdown happened, as it was COVID was building. I had instructors getting upset that their room or area didn't smell like it had been cleaned, being that it was cleaned at midnight and he showed up at 9 a.m. and whatever chemical we'd used, it had dissipated, but he didn't want to believe that we'd actually clean the area. So I'm one for right now, the best for custodial all around is to be seen doing the work.
Be seen. Okay, great. Kim, I'm sorry, I think we have to wrap up, and I want to give it back to Sarah to do final words.
Oh, no problems.
Sarah?
Thank you, everyone, for everything that you shared today. So many questions and great information shared. We also want to take a moment to thank our sponsors, the sponsors of the Healthy Green Schools and Colleges program, including and especially Platinum sponsor Diversey, for their continued support. So thank you, all of our sponsors. And thank you again, Merv, Chris, Kim, and Mark, for taking time to participate in this really important discussion with us. Thank you everyone for attending. You'll see my contact information on the screen here. Please do reach out if you have any questions. And just a reminder that we will be sending out a follow-up email with a link to the recording of today's webinar and also a link to the resource hub that we've mentioned, with a lot of different resources shared by today's speakers as well as the speakers from last week's webinars as well. So lots of resources there. Do check it out and make sure to, if you're not already signed up for the Healthy Green Schools and Colleges newsletter list, please do that as well. I'm sure that we will be hosting more webinars later this year after the school year resumes. So thank you everyone for your time. Stay safe and be well. Have a great day.